Which camera is it? That one? Well, good afternoon, Long Beach. Today is our briefing for January the 14th, and really a really, I think, important day for us. We have some both sobering news, but also some real hope in our vaccine rollout, which I would say here in Long Beach has been something we're very proud of and quite successful. Let me just begin before I get to vaccination, and we have a lot to announce, including some folks getting their vaccine. But let me just begin by giving some news about where things are at. The thing that's most sobering is, as of today, we now have over 500 people in our city that have lost their lives to COVID-19. In fact, we have 506 Long Beach residents that have lost their lives, and families and folks that have been impacted across the city. To those family members and to friends and coworkers, our love and our prayers are with you. And of course, that number is unfortunately going to continue to increase. But it's a sobering reminder that regardless of the hope around the vaccine, there's a lot of seriousness happening at our hospitals. Our hospital capacity remains strained. We still are at essentially a 0% capacity in our ICUs, and our hospitalizations are approaching 300 with people actually with COVID. And we know, of course, other folks are still using our hospitals for many other reasons. So this is a serious crisis still. There's a lot of serious work ahead. But I want to today focus on vaccinations and some of the good news that is happening in this area. Want to start just by reminding folks about how far we have come and where we are today as a city as it relates to vaccines. We have begun a massive vaccination rollout that has really taken us to today, where we're beginning the second phase, or Group B, of vaccination. We have already vaccinated a vast majority of our hospitals, our clinics, our dentists, our pharmacists, our paramedics, our firefighters. All the folks in healthcare have all either received their first vaccine and in some cases now are getting revaccinated. This is an incredibly good milestone for us at the city. We are proud of their work, and we're grateful to everyone involved in this huge undertaking in our city. And beginning today, our city begins rolling out Group B within those tiers. And we are now beginning the process of vaccinating seniors who are 65 and over, food workers, the ones that are working in our grocery stores, the ones that are at our markets that are preparing food, and our teachers and educators at Long Beach Unified School District, Cal State Long Beach City College, and of course our other private institutions that we have across the city. We are also today, and we'll begin that here in just a minute, vaccinating our emergency personnel at the city. So the folks that make up our emergency team and our city response, our 911 dispatchers. We have some police that are getting vaccinated today, and that continues on to next week. We have all the folks that have been responding to this COVID emergency for the weeks that have gone in the past. And so there's a lot of excitement today, and we're grateful. Let me begin by just talking a little bit about seniors. Starting this Saturday, we are vaccinating residents aged 65 and over. We know that it at one point was 75 and over. We've lowered that now to 65 and over. The first clinic is already full that we have this weekend. But if you are 65 or over, or your parent is, or your grandparent is, appointments can now be made. And those appointments can be made by emailing COVID-19 vaccine@longbeach.gov or by calling the info line, which is 562-570-INFO. And of course, be patient. We're getting back to those emails within a day or two. But please know that we will get you scheduled for a clinic if you are over 65 or 65 in Long Beach. And I'm proud to say that Beverly O'Neill, our former mayor, who is I think now 90 here in our community, is going to be amongst the first to be vaccinated this Saturday. So we're very happy for her and for every senior across our city. I also want to note that beginning on Tuesday of this upcoming week, we will also begin vaccinating our grocery workers. We are converting the Long Beach Convention Center into a mass vaccine distribution site. And the first folks to be vaccinated there will be folks that work at all of our local grocery stores and markets. You can now begin making these appointments by visiting the same email that I just discussed, but the fastest way is really to work with your employer. And so if you are a grocery store, you work there, please contact your grocery store and they will get you an appointment, or you can email the email I just mentioned. And we're going to start mass vaccinating every single day starting on Tuesday. And that includes all of our food workers, folks that work in markets, folks that are making food. Please reach out to us. We're going to start vaccinating you. And in addition to that, we begin our educators. And I'm happy to announce that we know that beginning on January the 25th, Long Beach Unified School District will start their vaccination process. And being announced today is that Long Beach City College will also begin their vaccination process that same week. Just spoke to the president of Long Beach City College moments ago. And so we will have both Long Beach Unified and Long Beach City College beginning the week of the 25th. And if you work at these institutions, please contact your institution and they're going to reschedule your vaccination. We hope to have an announcement from Cal State Long Beach as soon as Cal State Long Beach sets their vaccination schedule. And so we are anxious to hear when that will be, and we're looking forward to that. And so with that, I want to also just say a few remarks in Spanish, and then I'm going to turn this over to our health director, Kelly Colopy. Gracias por estar acá. Nada más quería decir que hemos hecho bastante progreso en las vacunas. Ya hemos vacunado a nuestros doctores, enfermeros, a gente que trabaja en los hospitales, en nuestras clínicas, la gente que está trabajando en healthcare por toda la ciudad. Y vamos a empezar ahora, esta semana que viene, a vacunar a profesores, a los que trabajan, los policías, los que trabajan en los supermercados. Y por favor, si necesitas información para tener tu vacuna, por favor, llámanos a un número que es el 570-4636, area code 562-570-4636, o por email a covid19vaccine@longbeach.gov. Pero te llamas, la información va a estar en la website de la ciudad también. So, por favor, ya estamos empezando estas vacunas y es algo muy está haciendo muy bien acá en la comunidad de Long Beach. And before I turn this over to Kelly, I want to also just say that per the advice of our health officer and Dr. Davis, myself, our director of health, and our city manager will all be receiving the Moderna vaccine today, the first of two. And as part of our emergency response team, it's an honor to do so and to let people know that it is safe. And I look forward to doing so, which we're going to do here on camera in just a minute. And so I want to turn this now over to Kelly Colopy for some additional remarks.
Thank you, Mayor. So I also wanted to let people know that, we did start with our healthcare workers and our frontline staff for the health department last week. And so Dr. Davis was the very first person of our health department and our emergency response who was vaccinated last week, was why she is not here with us today. I do want to just sort of share a little bit more about vaccine and sort of how we're organizing and to start to focus on our sort of the taking an equity lens about how we're doing our vaccinations. So as the mayor discussed, next week we are expanding our vaccination efforts to more groups. We've said all along that we'll be distributing these vaccines in an equitable manner based on those who are most at risk of getting COVID and those who are most likely to get ill from the disease. We've been getting our healthcare workers vaccinated for the last month. And this weekend, we will start vaccinating our older adults, as the mayor shared, which is one of our most critical populations. While the Saturdays clinic is full and we'll be notifying people who are on the wait list and connect you to another appointment, there will be ongoing opportunities for people over the age of 65 to be able to be vaccinated. We're also very excited that over the next 2 weeks that we are going to be able to start to address our frontline workers, our food sector workers, and those in the education sector. These are the folks who are working with the public every day by offering essential services and putting their health at risk every day when they're doing their jobs. Because of the nature of their jobs, many of these workers, like people who work in grocery stores and restaurants, cannot work from home and may not always be able to stay physically distant from others. These folks play a critical role in keeping our city functioning. We know that many of our frontline essential workers are people of color, which makes ensuring that they are vaccinated a matter of equity. Our Black and brown residents have been disproportionately affected by COVID-19 throughout this pandemic. Our age-adjusted rates for hospitalizations and deaths due to COVID-19 is higher for our African American and Latino communities than it is for others. These populations are also more likely to have underlying health conditions as a result of long-standing inequities in our healthcare system and the effects of systemic racism, so they're more likely to have exacerbated symptoms that can lead to hospitalization and death. Vaccinating our educators and school personnel is also vital and an equity conversation. And it's very important that we get them vaccinated so that we can open our schools and be able to more fully engage our students in learning opportunities as soon as our case rates allow for us to open our schools. This step protects our children, our families, and our community at large. While at this time, all of our vaccine opportunities are being offered through large-scale drive-through efforts, we will be offering mobile vaccine opportunities starting in early spring. This will allow us to bring vaccine to communities who are most impacted by the virus, creating greater access and greater opportunity for people who cannot make it to the large-scale drive-through opportunities. We're enthusiastic about reaching this milestone in our attempts to combat this epidemic. While we still have a way to go in getting vaccines to everyone who wants it, we know that giving these workers and older adults an opportunity to be vaccinated will have a tremendous and powerful impact. And with that, I'm going to turn it back over to the mayor. Thank you.
Thank you. And the last thing I will add, and then we're going to take some questions and then do the vaccine, is next week we know that there's still a lot of questions about getting vaccinated. So we're going to use technology to really help us in this process. We're launching a program called VaxLB, which is going to be an online portal that launches next week. Anyone in the city will be able to put their information into this portal, and then we will email you and contact you when it's your turn to get vaccinated. We will also send you regular updates on how vaccinations are going, and so you won't have the worry about when your vaccination is coming. We will give you that peace of mind, and that launches next week. And so we are excited about that. Let me add that la próxima semana vamos a tener un programa en la ciudad que va a ser en el website, que vas a poder poner tu información y tu nombre, y te mandamos un email o información para cuando te van a dar la vacuna. And so we are excited about that. And as we take this, I just want to make very clear to the media, I've been reading a lot of reports about disaster stories happening other places, other counties, other cities, some horror stories. That is not happening in Long Beach. Our vaccination process is going well, it's positive, and we're getting through our vaccine and people. So we are heartened because of this amazing team we have and the work that they're doing. So let's open up for some questions.
Okay, thank you, Mayor. This is good afternoon. I'm Jennifer Rice Epstein, the Public Affairs Officer with the Long Beach Health Department. I'll be reading questions from the media, and these first questions are for you, Mr. Mayor. Kelly Puente of Long Beach Post asks, how has having your own health department for the vaccine rollout been helpful? And do you feel that this is an advantage that has put the city ahead of other jurisdictions for moving through the phases?
Having our own health department has been wonderful for us. And, we know that that it gives us the ability to as our own health jurisdiction, to make some of our own rules. We know, obviously, we have to follow state guidance, and we're always aligned with the state, but it allows us to move, I think, much more nimble, quickly, make decisions faster, and really focus on this as an issue, and allows us to take care of our folks. So I think having our health department has been fantastic. The other thing is it's having an amazing team. I mean, Dr. Davis Kelly, who you heard from, and everyone else has been fantastic. Our vaccine team, and I have a joke where I've been telling everyone that I talk to, like I also like I'm the mayor, but I'm also like I'm our vaccine czar, and I every morning, and Tom knows this, and Kelly knows this. I'm pile driving the vaccine questions, and it's top of mind for me and for our entire team. So we're going to focus on this, and we're going to be obsessed with this every single day.
Our next question is from Haley Wenzo of Fox 11. I understand local mayors are asking the feds to send vaccines straight to them, bypassing the state and county. Is that what Long Beach is trying to do?
Well, right now we are getting direct allocation because we have our own health department. But the answer to that is yes, we want more vaccine. And so we are getting vaccine, but I've already reached out to our partners at the county, and we've already made the offer and said, hey, if you can get us some of your vaccine, we'll vaccinate more. We want to vaccinate more. We have the capacity to do more. It's just all about how it's coming in. And so we're going as fast as the vaccinations come in. But I do support, particularly for large, dense cities, those vaccines should be coming straight to cities if possible.
Next question's also from Fox 11. With everything you've had to go through personally, what does it mean for you to be getting the vaccine today?
Honestly, I'm a little emotional about it, to be honest. But it's been more heartening to see so many people vaccinated over the last month, and so I was very moved when I saw the first person in Long Beach get vaccinated now, like a month ago, which was one of our amazing nurses at Long Beach Memorial, and so I've seen thousands and thousands and thousands of folks get vaccinated over the last month. And so to be here at this point now where we are moving through now this next phase of essential workers as classified by the state, I'm excited, and I'm heartened, I'm humbled by it. And I also want to show people that it is safe and that everyone should get vaccinated.
Last question is from Norma Ribeiro of Telemundo, and she'd like you to answer this in Spanish if you could. Her question: Los Angeles County is still only vaccinating healthcare workers and people living in assisted care facilities. Can you explain why Long Beach is moving faster than the rest of LA County in the phases of vaccination?
Acá en la ciudad de Long Beach estamos haciendo muy buena con la vacuna porque tenemos nuestro departamento de salud acá. Ya estamos vacunando más gente que en otros lugares, en otros estados y en otras ciudades. Ya hemos casi terminado todos nuestros gente que vive en los nursing homes, en los hospitales, en las clínicas. Ahora estamos vacunando policías y gente que trabaja en los supermercados y gente que tiene 65 y más. Y yo creo que es porque tenemos acá una ciudad y un grupo de gente que está trabajando bien duro para vacunar más gente y más gente todos los días. So, es algo que acá en Long Beach, las vacunas es la prioridad más importante ahorita, es poner vacunas en la más gente que podemos poner. Y yo sé que el condado de Los Ángeles es bien grande y nosotros ya los hemos dicho también a ellos, si necesitan ellos ayuda, que los den más vacunas a nosotros y nosotros vacunamos más gente en nuestra comunidad.
Our next questions are for Kelly Colopy, Director of the Department of Health and Human Services here at the City of Long Beach. Kelly, our first question is from Lauren Leister of KTLA. She asks, how do people show that they're in a group eligible for the vaccine in terms of documentation? And what measures are in place to prevent people who are not eligible from cutting in line?
Yeah, so we ask that anybody who comes as part of their sector, so if you are a healthcare worker or you are a food service worker, that you either bring an ID from your job, like badge or something, or that you have a pay stub, a most recent pay stub, or that you have on official letterhead with your name on it that you are that you work for that location. And so any of those three things qualify, and we're happy to let people through. In terms of those who are currently 75 and over and moving into next week 65 and over, we are asking that people bring whatever they can as proof of birthday. And so we will be asking and looking at the birth dates. Aside from that, we don't ask for any other ID. We are looking for people only in the city of Long Beach right now as well, if you are over the age of 65. In terms of how do we make sure people don't jump the line, so we have a lot of folks who are lined up that are our employees who are checking in. So we ask everybody who pulls up while they're in the line to please provide their proof. If they do not have the proof that we are asking for, then we do ask that they move along. And so we have turned away quite a few people who are coming from outside of the city or who are in tiers that are not yet being served.
Haley Mungia from Press Telegram asks, how often is Long Beach receiving vaccine doses, and how many is in each allocation? And has the city had to discard any unused vaccine doses?
So we receive vaccine every week. The vaccine allocation looks different every week. So 1 week we might get 11,000 doses, and then next week we might get 1,000 doses, and 1 week we might get a whole we might get a whole lot of Moderna, and then the next week we get Pfizer. And so we usually learn on Tuesdays how much will show up either that next Friday or Monday, and that is what we are using to plan to move forward with our pods. We have not had to discard any vaccine that has arrived to us ready to use. We are doing everything we can to make sure that once we open a vial of vaccine, that we make sure that it is fully utilized.
Now Mayor Garcia, followed by City Manager Tom Modica and Health Department Director Kelly Calpe, will receive their first COVID-19 vaccines, with a wrap-up in Spanish to follow. Okay, and we'll now have Spanish interpretation, and she'll wrap up.
Muy buenas tardes. Como escucharon al alcalde, hoy empezamos las vacunaciones para la fase 1B. Kelly Colopy, la directora del Departamento de Salud y Servicios Humanos de la ciudad aquí de Long Beach, nos acompañó y reiteró que la semana que viene ampliaremos nuestros esfuerzos de vacunación a más grupos, el grupo de fase 1B. Distribuimos las vacunas de manera equitativa en función de los que tienen más probabilidades de contraer COVID y de los que tienen más probabilidades de enfermarse seriamente por la enfermedad. Hemos estado vacunando a nuestros trabajadores de salud durante más de un mes y este fin de semana comenzaremos a vacunar a los adultos mayores, una de nuestras poblaciones más vulnerables. Estamos muy emocionados que durante las próximas 2 semanas se vacune a un grupo de trabajadores que están en la primera línea, trabajadores del sector alimentario y del sector educativo. Son personas que trabajan con el público ofreciendo servicios esenciales y ponen en riesgo su salud todos los días cuando realizan su trabajo. Debido a la naturaleza de sus trabajos, muchos de estos trabajadores, como las personas que trabajan en supermercados o marquetas, no pueden trabajar desde casa y no siempre es posible mantenerse físicamente distanciado distantes a los 6 pies que es recomendable. Estas personas juegan un papel fundamental en el funcionamiento de nuestra ciudad. Sabemos que muchos de nuestros trabajadores esenciales de primera línea son personas de color, lo que hace que vacunarlos también sea una cuestión de equidad. Nuestros residentes afroamericanos y latinos se han visto afectados de manera desproporcionada por COVID-19. Las comunidades afroamericanas y latinas tienen un mayor riesgo de ser hospitalizados debido a COVID o morir a causa de la enfermedad. Este grupo también tiene más probabilidades de tener problemas de salud subyacentes como resultados de las inequidades en nuestro sistema de salud y los efectos del racismo sistemático que pueden llevar a hospitalizaciones y muerte más frecuentemente. Vacunar a nuestros educadores y personal escolar también es vital para poder reabrir nuestras escuelas cuando los casos bajen y sea seguro regresar nuestros estudiantes a sus clases. Este paso protege a nuestros niños, familias y nuestra comunidad en general. Aunque en este momento las vacunaciones están siendo ofrecidas por automóvil, tendremos vacunaciones móviles a principios de la primavera. Esto nos permitirá traer la vacuna a comunidades que son más impactadas por el virus, creando más acceso y oportunidad. Estamos entusiasmados por alcanzar este nivel en nuestros intentos de combatir esta epidemia, aunque todavía nos queda mucho camino por recorrer para que todos los que quieran vacunarse tengan acceso. Sabemos que darle a estos trabajadores y adultos mayores la oportunidad de vacunarse tendrá un impacto tremendo y poderoso. Queremos agradecerles por acompañarnos hoy. Buen día. Thank you for joining us. That is all for today.